It's easy enough to know what VicHealth is and what it does, but like most things in this subject, we also need to be able to link it to other parts of the syllabus. In particular, you will need to be able to discuss potential health outcomes of VicHealth-funded projects. In this video, we're looking at how to do just that. First, let's have a look at some of the programs and initiatives that VicHealth is presently funding. These range from the Walk to School campaign, the Water Initiative, and the Alcohol Cultural Change Project, amongst many, many others. All of these are likely to improve health outcomes. For example, the Walk to School campaign, which has been running since 2006, is an annual event. It encourages children to walk to and from school more often, which is likely to have widespread consequences. Children will improve their physical health, their social health may improve if they walk with friends, there will likely be fewer environmental problems, and so on. If we're talking about the program's impact on health status, we can also bring in some health status indicators. For example, perhaps burden of disease will decrease due to the children's greater level of physical activity, or maybe health-adjusted life expectancy will increase due to the children's reduced likelihood of becoming overweight or obese. Since 1987, VicHealth has funded the QUIT program, assisting smokers to reduce their tobacco use. This initiative would likely reduce the chance of lung cancer, thereby improving physical health, and would have a positive impact on life expectancy, whilst reducing morbidity and mortality rates from lung cancer. So as you can see, to link VicHealth-funded projects to potential health outcomes, we need to be aware of two things. Firstly, what a VicHealth-funded project is, and secondly, what a potential health outcome is. Not too bad at all. So say we had a case study, like this one from the 2013 VCAR exam that read, "The SunSmart program is jointly funded by Cancer Council Victoria and VicHealth. The original campaign, Slip Slop Slap, has evolved to include Seek Shade and Slide On sunglasses. And the program focuses on both the harms and benefits of the sun's ultraviolet UV radiation. The success of the program has resulted in Victorians being more than twice as likely to wear hats and sunscreen as they were in the 1980s. More than 90% of all Victorian primary schools are now participating in the SunSmart Schools program." What if there was a question like this? Explain the potential health outcomes of the SunSmart program. Just as we linked some of VicHealth's other programs to health earlier in this video, we can do the same here. First, we should link to a dimension of health before bringing in a health status indicator. So we could say something like, the SunSmart program will likely improve physical health. More than 90% of all Victorian primary schools are now participating in the program, which should result in greater protection of primary school-aged children from harmful UV rays. This means that health-adjusted life expectancy may increase, as the incidence of skin cancer should lessen. Mortality rates from skin cancer should also decrease. Below this video, there are some questions that ask for likely health outcomes of VicHealth-funded projects. Why not try for yourself? In the next video, we're looking at something quite similar, how VicHealth projects reflect the social model of health. Bye for now and happy studying.